Welcome to our presentation. The Bariatric and Metabolic Institute is proud to present this seminar as an introduction to what we offer and how we can help you to change your life and improve your health through weight loss. We invite you to fill out the contact form at the end if you would like more information or to schedule a consultation. Our mission? We provide weight management solutions with a personalized approach to help you achieve your goal of improved health through weight loss. We strive to instill confidence and knowledge so that each person has the ability to excel in this journey and to make these changes meaningful and long-lasting. What is considered overweight, obese? BMI, Body Mass Index, uses height and weight to give a numerical score that defines categories of body weight. Normal is 19.9 to 24.9. Overweight, 25 to 29.9. Obese Class 1, 30 to 34.9. Obese Class 2, 35 to 39.9. Obese Class 3, 40 plus. What is the motivation for weight loss? Wanting to look and feel better, and to fit into those clothes you used to wear is only part of the equation. Obesity affects our health in ways we may not even realize. Some of these ailments are well known and somewhat obvious. For example, most people are aware that being overweight puts extra stress on your back or knees or hips, and that your chances of heart disease or diabetes are much higher. However, other diseases that don't get as much attention, like sleep apnea, fatty liver disease, and polycystic ovarian syndrome, are actually quite common in our patients. The good news is that many of these conditions can be dramatically improved, and in some cases eliminated, with successful completion of our program. In addition to improved health, decreased number of medical problems, and fewer medications to take, there are vast improvements in perceived quality of life, longevity, and even reduced risk of developing certain cancers. Treatment for excess weight obesity depends on your level of obesity, overall health condition, and what expectations you may have. Individual treatment options will be discussed with your doctor or nurse practitioner. If you are overweight, remember that losing as little as 7 to 10% of your body weight may improve many health-related conditions linked to excess body weight. Let's begin with our medical weight loss options. At the Bariatric and Metabolic Institute, we have 3 medically monitored plans to help you lose weight and become healthier. Using nutritionally complete meal replacements, our VLCD, Very Low Calorie Diet program, enhances the body's fat-burning ability while keeping hunger and cravings at bay for rapid, safe weight loss. Participants use 3 to 4 meal replacement products per day along with a snack to satisfy their daily needs. We carry a wide range of meal replacements and snacks, from smoothies to puddings to party mix. We have something for everyone. To ensure health and safety, patients will check in once a week and meet with a nurse practitioner once a month to review labs and address questions or concerns. Expected weight loss is 3 to 5 pounds per week. Once participants are within 5 to 10 pounds of goal weight and have completed Phase 1, they can transition into Phase 2. Our first option in Phase 2 is the Outlook Plan, where a registered dietitian will create a personalized meal plan for you using a combination of grocery store foods and meal replacement products. Patients will check in once a week and meet with a dietitian once a month to review progress and make adjustments to diet and exercise plan. Expected weight loss is 1 to 2 pounds per week. Another option in Phase 2 is intermittent fasting. On this plan, patients fast 3 to 4 times per week to naturally balance hormone levels and promote gradual weight loss. Meal replacement products are recommended per dietitian. Patients will check in once a week and meet with a dietitian once a month to review progress and make adjustments to diet and exercise plan. Expected weight loss is 1 to 3 pounds per week. Studies show that people are most likely to experience weight regain in the first 2 years after weight loss. Continued program participation and follow-up have shown to improve weight maintenance success. We encourage scheduled weight checks and periodic follow-up with a provider for accountability and support. Our goal is to teach lifelong habits that will not only help patients lose weight, but keep it off. We encourage participants to attend one of our check-ins offered throughout the week. Following each check-in, we hold a 15 to 30-minute class on various topics pertaining to diet, exercise, and behavior change. Meal replacement products may be purchased at monthly provider appointments or during weekly check-in. We provide exercise classes designed to get you started with basic cardio and strength training. We're aware that many participants may have physical limitations that require individualized modifications. Now let's discuss the surgical options. The field of bariatric surgery has made great strides in improving safety and quality with major complication rates of under 1%, making this surgery as safe as many routine surgeries such as joint replacement surgery. Success rates of weight loss in individuals who are morbidly obese without medical supervision are unfortunately quite low. Surgery has been shown repeatedly to provide the most powerful and longest-lasting results. Why do people choose weight loss surgery? Fear of developing additional obesity-related diseases. Diets have failed. Many dieters regain weight in the first year. Surgery has been proven successful in the long term, 10+ years. 30 to 40% reduction in mortality at 10 years. The evidence supports that the risk of surgery is far lower than the risks associated with having a long list of health problems over decades of time. Bariatric surgery. Who is eligible? If you have a BMI of 40 or higher. If you have a BMI over 35 with obesity-related health conditions. Unsuccessful weight loss maintenance. You must understand the operation as well as the lifestyle changes that will need to be made. No alcohol or substance abuse, including nicotine. No uncontrolled psychological or depressive disorder. FDA approved in 2001 with great fanfare and enthusiasm from doctors and patients alike. The first 10 years enjoyed great success, with hundreds of thousands of bands implanted. Unfortunately, after a decade of experience, it became clear that the results of this surgery are quite variable, with many patients ultimately being unsatisfied with their weight loss. In addition, there is a high reoperation rate, meaning something would happen with the band that would require further surgery. As such, the number of lap band procedures has decreased significantly. It is reserved for patients who otherwise might not be candidates for the other weight loss procedures. The surgery is performed laparoscopically, meaning multiple small incisions. It is so minimally invasive that you can potentially go home the same day. It works by placing an inflatable band around the very top of the stomach. A piece of tubing connects the band to a small port, or reservoir, that is implanted under the skin on the abdomen. After the surgery, your doctor places a needle into the port and can inject saline solution to fill the band in order to make it tighter. A well-adjusted band allows for passage of liquids into the stomach, but stops solid food so that patients feel full after just a small amount has been consumed. The sleeve procedure also debuted in 2001, but took around 10 years to really gain popularity. It is now the most frequently performed weight loss surgery in the United States. It has an excellent track record of good weight loss and very low complication rates. It is also performed laparoscopically and typically requires just an overnight stay in the hospital. Patients will lose 60% of their extra body weight in the first year after surgery, on average. This operation involves removal of around 2/3 of the stomach, such that the portion of remaining stomach is shaped into a tube. The stomach now holds much less food than before, and the surgery also causes a decrease in appetite hormones, so that you tend to not be as hungry after this surgery. The gastric bypass procedure has been around since the 1960s. It became much more popular after the era of stomach stapling procedures of the 1980s, when in the mid-90s surgeons discovered how to perform gastric bypass laparoscopically. This is a powerful weight loss procedure that involves division of the stomach and a piece of intestine, although no organs are actually removed, unlike the sleeve. With gastric bypass, the stomach is divided such that the portion that will ultimately hold food is very small, roughly the size of an egg. The remaining part of the stomach retains full function and continues to produce acid and enzymes, but no food will go into this part of the stomach. The intestine is then divided and connected to the small stomach pouch. This allows food to bypass over the stomach, which causes a decrease in absorption. Due to the decreased intake of food, decreased absorption of food, and changes in multiple digestive and appetite hormones, the gastric bypass procedure works in multiple ways to provide powerful weight loss. Patients tend to lose upwards of 70% of their extra body weight in the first year. This operation is also particularly helpful for patients with type 2 diabetes. It can eliminate diabetes entirely in some cases. This operation does have a greater number of possible side effects and complications, which will be reviewed a little later. Lap band surgery typically results in a loss of 40 to 50% of your extra body weight. The results are achieved more slowly compared to other surgeries. It can take 3 to 5 years to achieve your lowest weight after lap band surgery. The sleeve gastrectomy procedure results in an average weight loss of 60% excess body weight loss in the first year, whereas gastric bypass can produce weight loss in excess of 70% within the first year. How do I decide which operation is best for me? You and your surgeon both participate in this decision. Factors to consider. How much weight do you have to lose? Are you diabetic? Would you opt for a less effective, lower-risk surgery or a more effective, higher-risk surgery? It is not necessary to make this decision at the very beginning of your weight loss journey. Some patients think they only want medical weight loss and end up choosing to have surgery. Some patients begin thinking they want to have surgery and ultimately choose to simply follow one of our medically managed weight loss plans until they meet their personal goals. We will help you to make the best decision for you and your health. Risks of surgery. Even the simplest surgery can have complications. No matter which procedure you may be considering, realize that having anesthesia for any surgery can carry certain risks that may include heart or lung complications and blood clots. In addition, all surgeries can potentially be complicated by bleeding and infection. Please understand that as a bariatric center of excellence, we have protocols in place that meet national standards and have brought complication rates down to an absolute minimum. Depending on which surgery you choose, there can be complications specific only to that procedure. For example, in the lap band surgery, the band can slip. This can be minor or major. The correction of this problem is sometimes as simple as loosening the band, or can sometimes require the entire band to be surgically removed. The band has also been known to wear its way into the inside of the stomach, that is known as erosion, and is a rare complication. It requires the band to be removed. Much more common are complications of the band port and its tubing. This can break, be punctured, leak saline, or become turned upside down such that adjustments are difficult or impossible to do. For the sleeve gastrectomy procedure, the most feared complication is known as a leak. This means that the line of staples that was applied in performing the surgery has not perfectly sealed, and things that you swallow are able to spill out into the body. This can make you very sick and needs to be dealt with urgently. It can be very difficult to fix this problem, requiring stents and drains, antibiotics, and nutritional support. The chance of a leak after the sleeve surgery is about 1%. In addition to leak, some patients complain of nausea, but this tends to improve over time. The sleeve can also heal in a way that makes it quite narrow, known as stenosis, which can result in frequent vomiting, but this is very rare. The gastric bypass procedure, although it can produce the greatest weight loss, also has the highest complication rate and higher number of possible complications. Like the sleeve, you can also develop a leak after gastric bypass. However, unlike the sleeve, with gastric bypass, there are actually 3 places where you could develop a leak. Also, where the intestine has been connected to the small stomach pouch is quite vulnerable to ulcers. Smoking and some over-the-counter pain medicines can greatly increase the risk of ulcer. The connection between the stomach and intestine can also heal in a way that makes it very narrow and can be stretched with a balloon as needed to correct that. There is a risk of intestinal blockage and also a risk of what is known as an internal hernia. This is where much of the intestine becomes trapped between the Y of the Roux-en-Y and can cause a blockage or a constriction of blood flow that can be very dangerous. In addition to these complications, keep in mind that because of the decreased absorption with this surgery, your chance of a deficiency of many vitamins and minerals is increased. This slide shows the risk of death after bariatric surgery as being lower than many commonly performed surgeries, including hip replacement and gallbladder surgery. Post-surgical follow-up. Follow-up after surgery is every bit as important as the surgery itself. If you have ever known someone who had weight loss surgery but ultimately regained their weight, they likely were lost to follow-up. Coming back to the clinic regularly and as scheduled is crucial to the success of your surgery and to your long-term results. With surgeon or nurse practitioner at 1 week, 1 month, 3 months, 6 months, 9 months, 12 months, 18 months, and then annually. With dietitian at 1 month, 3 months, and 6 months post-op, available for further follow-up if needed. Post-bariatric surgery support group, see bmiclinic.com for schedule. Surgical candidates must attend at least 1 session prior to surgery. We would now like to highlight just a few patients as an example of what you might experience if you choose BMI and Elkhart General Hospital for your weight loss goals. Julie is a very successful patient who lost all of her weight through our medically managed weight loss program. As you can see, her result has been dramatic and durable. Cheryl is a patient who started in our medically managed weight loss program, who felt herself continuing the cycle of weight loss followed by weight gain, and ultimately decided to switch tracks and pursue surgery. Since her sleeve gastrectomy, she has achieved her weight goal. Laura has had great success with the sleeve gastrectomy procedure. And even though the average weight loss is 60% of your excess body weight, Laura was able to lose 100% of her extra pounds. In fact, many of our patients exceed the expected average weight loss. One of the most common things we hear from our patients is, "I wish I would have done this years ago." Contact our Bariatric and Metabolic Institute office either through our website or by phone at 574-296-3348.